Santerre. I'm the staff neurologist and intern director here at the Veterinary Referral and Emergency Center of Westbury. I hope that this aids in your knowledge of our hospital. Both I and Dr. Shaylin Meyer will be giving you a tour of our facility. This way you can kind of get a feel of what services we have, what equipment we have, and we'll also be meeting some of the staff along the way. So sit back, enjoy the ride, and if you have any questions, you know where to find me.
All right, first I'm going to show you guys our reception area and waiting area, if you want to follow me. All right, so up here we have our lovely CCRs who work with us between 7 a.m. and 1 a.m. They're going to be our first point of contact between our clients and ourselves. They'll field all the phone calls and make sure they go where they need to go. Pre-COVID, our waiting area would be full of our clients and patients, where they'd be checking in or waiting to be seen by our ER or other specialty services. Unfortunately now, because of COVID, we don't really have very many people in the building except for some circumstances, but certainly, hopefully we can get back to that at some point.
Hi, I'm Nicole. I'm the service coordinator for the surgery and neurology department here at the hospital. I've been here for about 12 years. I just got my promotion to the liaison position about a year ago. I've seen many an internship class come through here. They've all been wonderful. I'm looking super forward to meeting all of you. And if you have anything that you need along the way, I'm always here to help.
Hi, my name is Angela. I'm the service coordinator for internal medicine and oncology. This is Louie. We're both very excited for our new intern crew coming in June, and we're both here to help you guys with whatever needs in internal medicine or oncology that you have. So just come by and say hi when you're here.
All right, so while you're an intern here, this is where you spend most of your time doing lots of paperwork. These are the bays that we have for our computer access. That way you're nice and close to our ICU. Here we have our fully stocked lab. We have stat CBC, stat chem, our blood gas machine. We have microscopes so you can do your cytologies. Anything you pretty much need point of care here for a critical patient or even our stable patients.
Hi, my name is Christine. I've been with VCA for about 15 years now. I'm really excited to see the new intern class, and anything that I can help you with when you come in radiology or the lab, we're here to help you. Welcome.
Welcome to our ICU, where we have all our hospitalized patients. As you can see here, we have smaller spaces for our cats and dogs. We also have Snyder for oxygen capability, and then larger runs for our larger patients.
Hello there, how are you? My name is Michael. I'm one of the licensed veterinary technicians at VREC. I've been here for about 20 years. It's a wonderful place to work. I've actually learned a lot. The interns coming and going has been really, really fun. I've never worked at a specialty facility like this, so very happy to see you guys come through, and I like to see how you guys learn, and with our help and guidance at the end of your session here with us, hopefully you'll be a lot more skilled and ready to be let go on your own. So, wishing you the best of luck.
I'm Amanda. I'm the assistant supervisor. I oversee about 15 assistants. I've been here for 11 years. I've seen multiple classes of interns come in and out, and I love seeing their development and their knowledge grow.
Hey, I'm Lindsay Pfeiffer. I'm one of the staff criticalists here. I can't wait to see you guys all via Zoom. I know it's a little socially distanced this year, but we all want to be safe. Right now is actually a great time for me to get a chance to talk with you because today is an exceptionally manageable today. Typically, where our ER and our ICU is quite busy, and we're looking at between anywhere of 10 to upwards of 30 cases on a daily basis or a day basis, and that it goes into the evening. And our ICU usually has anywhere between 8 to 15, 20 inpatients, depending on the services that are running that day. We also are going to make sure that we get you guys Recover trained. For those of you who don't know about Recover, it is the CPR initiative that helps give clear guidelines on what we should be doing in CPR in our small animals. So we want to make sure that you get that hands-on training as well as didactic and get that rescuer certification so that when you finish your internship here, you're ready to go out into general practice, into ER medicine, or advanced specialization, but know how to run those codes successfully. Hey, Dr. Fafer again. I look a little bit different as I'm wearing my mask. We're now in our ICU. This is our crash table where any kind of critical patient that comes in through the door or something that maybe seems a little bit more unstable, or certainly animals that arrest in our ICU, they get moved over to this table so that we have a lot of equipment here that's available within just a few feet. You can see here, this is our bedside ultrasound machine, really great to use for quick AFAS, TFAS, looking for free fluid, obvious masses. And you can also start to assess the heart and see if there's evidence of congestive heart failure. We have a monitor up here, which has capabilities for our ECG, blood pressure, pulse ox, as well as end tidal if you do have a patient intubated. Our anesthesia machine, so if the animal needs to be intubated or given flow-by oxygen, we're able to do that pretty quickly in this area. There's always pumps that are nearby to be able to administer fluids quickly, or you can use the pressure bag. Also, within immediate range of here, we have a defibrillator for those patients that do arrest and have a shockable rhythm. Below that is our crash cart. All of that contains our endotracheal tubes, your laryngoscope, any emergency drugs that you may need. There's needles, syringes, emergent things for like cut down if you need to get venous access quickly but are having trouble with just kind of poking around, especially in those deceased animals, as well as other miscellaneous things that you could need in that very emergent situation. You can see here, this is our triage board, so cases that are coming in that get paged overhead. Once they get their vitals taken, they're written up on this board so we can keep track of them throughout the day. Doctors sign up from them and we just kind of keep updating that as we move along. On this monitor here, this is our telemetry monitor, so any patient hooked up to telemetry, you're going to get your continuous ECG there. I think we have the ability to do up to 6 patients. Which gets a little crowded. Generally, we probably have no more than 4, but it can get quite busy up there sometimes. Other things that we have here in our crash table, all the various things that you would need for catheterization, as well as various syringes if you're pulling blood on an animal, collecting urine samples or doing abdominocentesis, and then various tubes to put those fluids in. Nearby, there's also larger syringes in here and miscellaneous equipment for things like laceration procedures, or if you need suture, if you're putting in nasogastric tubes, a lot of that is in and around this area as well.
And here's radiology, where we have full x-ray capability. And here we have the home of oncology. Here's our hood so that we can administer chemotherapy to our patients. And this is the space Dr. Linderman works in every day.
Hi, I'm Dr. Linderman. Welcome to the Oncology Service. We're hoping during your internship we get you associated with how all the common cancers behave and get you familiar with how to do diagnostic workups. Look forward to you joining us.
All right, welcome to the home of neurology, our MRI space. So right here we have our H-spot for patients that may be suffering from inflammatory conditions such as pancreatitis. Over here we have electrodiagnostic capability, bear testing as well as EEG. All right, and here we have our 1.5 Tesla MRI. Alright, this is our special procedure room where we have endoscopy as well as video otoscopic capability.
Linda Heselton. I'm the Purchasing and Facilities Manager here at VREC. I have been here for 18 years. I enjoy when the new interns come in because they seem like little children and they're scared. And then I watch them throughout the year grow and learn and feel more confident in their knowledge. They learn how to speak with the clients, come up with diagnosis and what diagnostics they should run. And you can see it as each week passes how much more confident they feel. So, and we have a lot of fun here, so it would be great to have you come and visit with us.
Hey guys, welcome to our surgery department. Here we have 3 ORs. So first we have OR1. So OR1 is where we do our soft tissue procedures. They're getting ready to do hemoabdomen right now. And then we have OR2. This is an OR where we do orthopedic and where I do my neurosurgery procedures. And then OR3. So OR3, not only do we do neuro and ortho, we also have laparoscopic capabilities and our fluoroscopy. So this is more of our specialty room.
All right, and this is the home of our internal medicine department where we have our ultrasound machine.
And this is our 16-slice helical scanner. Hi, I'm Dr. Sue Kimmel. I am one of the internal medicine specialists here, but I'm also the medical director. I've been here actually since the hospital opened back in 2003, and I'm really excited for our 18th intern class to come. It's a shame we can't be in person, but I'm really looking forward to having you here and coming through on our internal medicine service.
We also have a conference room where we hold daily patient rounds with every doctor in the hospital. In addition to these rounds, prior to COVID, we held CE events for our local primary care veterinarians and were able to house up to 55 guests.
Hello, my name is Patricia Orlando. I am the Hospital Director at Veterinary Referral and Emergency Center of Westbury. I've been here for 13 years and I love the internship program because we get to be a part of your continued growth and development. So sorry that we're not able to interview and meet as we normally would, but look forward to seeing all of you in June.